take-home message is that there's a strong commitment from the stakeholder community in the healthcare space, as well as key members of the European Parliament involved in healthcare discussions, to work together to promote access to healthcare across Europe in a more equitable way, because there are really challenges between European countries, with poorer countries having less access than wealthier countries, obviously. But also, as was displayed by some of the presenters, there are also major access to healthcare issues within even wealthier countries in Europe, and that's something that I believe everybody thinks should be tackled. Well, I think in every European country, to a greater or lesser extent, there's a real challenge on how to maintain universal access to healthcare. Everybody recognizes the challenge. It has to do with austerity. It has to do with the challenge of financing the cost of healthcare. At the same time, all the stakeholders and the politicians recognize that investing in healthcare is really a benefit, of course, for the well-being of people, but also there's an efficiency and an economic benefit to doing this, as well, as was demonstrated by many people in the room. I think now, to move it forward, we need to have concrete solutions where Europe can outline a vision to help the member states address some of the challenges. Again, talking about medicines, I think it's clear there are a lot of inefficiencies, a lot of barriers to competition in pharmaceutical markets, which can be removed relatively quickly. That will stimulate better access to medicines. But there's also work to be done around the efficiency of healthcare systems to make sure that they're as efficient as possible, so we're using the money that we have efficiently to treat more patients. And third, I think there's going to be an important policy discussion about investing more in health. That's obviously very challenging in these difficult financial times, but I think it's really necessary if we want to make sure that we safeguard universal access to health.